What happens when the people do not have clean water or proper sanitation? The answer is simple. People get sick, the environment becomes polluted, and communities suffer. Our research entitled A World at Risk, Water Pollution and Poor Sanitation in Developing Countries focuses on water pollution and poor sanitation, which are major global problems today. Many rivers, lakes, and groundwater sources are contaminated because of untreated waste, chemicals, garbage, and poor drainage systems. And billions of people around the world still do not have access to clean toilets and safe drinking water. This issue is connected to United Nations Sustainable Development Goal 6, or Clean Water and Sanitation, which aims to provide safe and clean water for everyone. According to United Nations Environment Program, around 42% of household wastewater is not safely treated before being released into the environment, and about 3.5 billion people still lack safely managed sanitation services. Our study mainly focuses on developing countries such as Pakistan, Nigeria, Ethiopia, and the Philippines, because these countries continue to struggle with polluted water, poor sanitation facilities, poverty, and weak infrastructure.
Water pollution continues to increase because untreated sewage, industrial waste, plastics, and chemicals are dumped into rivers and oceans. And many developing countries lack proper wastewater treatment systems, making the problem even worse. In Pakistan, around 25 million people still practice open defecation, and many children suffer from diseases such as diarrhea, cholera, and typhoid because of unsafe water. In Nigeria, poor waste disposal, oil spills, and flooding, and weak sanitation systems contribute to disease outbreaks such as cholera. In Ethiopia, many rural communities still do not have proper toilets or clean drinking water. In our country, the Philippines, water pollution remains a major issue, especially in urban areas. One major example is the Pasig rivers. Waterways are polluted because of garbage, untreated sewage, and industrial waste. Flooding and poor drainage systems also increase the spread of diseases such as leptospirosis, diarrhea, and cholera. Overall, these countries shows that the water pollution and poor sanitation are not isolated problems. They affect health, education, the environment, the quality of life, especially among poor and vulnerable communities.
Now, let's move on to the solutions. Different governments and international organizations are working together to improve water quality and sanitation. Organizations such as World Health Organization, UNICEF, and the United Nations support programs related to clean water sanitation and hygiene. This program focuses on building safe water systems, improving toilets and drainage, promoting hygiene education, and reducing open defecation. In Pakistan, programs like the Clean Green Pakistan movement encourage proper sanitation and environmental cleanliness, while in Nigeria, WASH programs and NGO projects help communities access safer water and sanitation facilities. In Ethiopia, international aid programs help millions of people gain better access to clean water and hygiene facilities, while in the Philippines, programs such as Philippine WASH Master Plan and iWash aim to improve sanitation services and reduce water pollution. Even though progress is happening, many problems still remain unresolved. That is why stronger government action, community participation, and global cooperation are important in achieving the Sustainable Development Goals 6.
To conclude, clean water and proper sanitation are basic human needs. Without them, communities face serious health and environmental crises. Our research reminds us that solving water pollution and sanitation problems is not only the responsibility of governments and organizations, but also individuals and communities working together to protect water resources and promote public health. Thank you, and that ends our presentation.